Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm both certified in internal medicine and lifestyle medicine. In just around 15 minutes, we'll bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we're joined by Dr. Gebre Nida. Dr. Nida is a triple board certified physician specializing in endocrinology, diabetes, metabolism, lifestyle medicine, and internal medicine. He practices at Cone Health, Ritzville Endocrinology Associates in Ritzville, North Carolina. He earned his medical degree from Addis Ababa University in Ethiopia. He completed his residency in internal medicine and a fellowship in endocrinology, diabetes, and metabolism at Wayne State University in Michigan. His professional interests include diabetes management, thyroid, parathyroid, adrenal, and pituitary disorders. He's particularly passionate about preventing type 2 diabetes through lifestyle medicine, emphasizing nutrition, exercise, and stress management to address chronic diseases. Beyond his medical practice, Dr. Nida is an avid long-distance runner, having completed over 30 marathons, including 5 Boston marathons. He leads the Greensboro chapter of Walk with the Doc, encouraging community members to engage in regular physical activity. His dedication to promoting healthy lifestyles has earned him recognition as a national leader in diabetes treatment. Welcome, Dr. Nida. So great to have you here today. How are you doing?
I'm great. Thank you, Dr. Patel. Thank you for having me on.
My pleasure. So let's start our conversation by exploring your path into lifestyle medicine. Could you share how your journey began and what specifically attracted you to this field?
All right. Obviously, this is a very interesting question for me. Thank you for the opportunity again. So yes, until March of 2022, I was really nursing my own frustration with the traditional practice of endocrinology, with some limitations, obviously. And then by almost sheer accident, I stumbled into an article written by the then president of American College of Lifestyle Medicine, Dr. Kate Collins. This is my opportunity to highlight my running. Obviously, you mentioned that. So after one of my long runs, I was doing some plank exercise. And to just distract me, I opened my phone and I saw an email article saying how to prescribe food as medicine. And obviously, it was interesting to me. I clicked it, and in 5 minutes of plank time, I read it. And, I never looked back. In that article, I found out that American College of Lifestyle Medicine exists. There are these pillars of lifestyle medicine, food as medicine, everything I was looking for. Basically, I did not put any focus on before. And then even before I took shower, I went to the computer and Googled it and became a member immediately. And from that day on, all of my CME, my time, my money is invested in lifestyle medicine, subsequently board certified. I'm sure we'll talk about it later. But that's how I became, familiar and knowledgeable about the existence of lifestyle medicine.
Great story. What an inspiration just from an article. So
right.
Yeah, awesome. Now, can you please share what your endocrinology practice was like before you started incorporating lifestyle medicine?
Again, another interesting question. I was interested in endocrinology 20 plus years ago, just by the sheer beauty of the science, meaning in endocrinology, basically the feedback, positive, negative feedbacks dictate what we do for our patients. If a hormone is up, you lower the level or you remove the source. If hormone is down, then you supplement it, right? And then that's why I was interested in endocrinology. However, what I found out doing was something intriguing, because, for example, if you take type 2 diabetes, it's already a high hormone state. But we are giving tremendous amount or industrial amount of insulin to patients. So that was some big question in my mind. What are we doing? The other thing is that I am a kind of a clinician, not a researcher. I tend to follow guidelines, and I was, in my mind, I was doing a great job following guidelines, doing this, doing that for my patients. But again, outcomes were dismal. I was not getting the outcomes that was required, or at least for my personal satisfaction also. The other thing is that one of the medications I researched before I signed up on endocrinology was insulin. And I remember reading somewhere that a statement saying, if you give 100 units of insulin to an average size cow, the cow will die. And I found myself giving hundreds of units of insulin daily to human beings, and they were not dying. So there was a big question, obviously. And then, every now and then I have opportunity to present on ADA standard of care to different groups, and I have to review the ADA standards of care yearly. And then based on those guidelines, expectations, I graded myself as a clinician, and I always gave myself F, because the guidelines are very intense. They are not achievable by just one provider and one nurse in a 5 minutes encounter with patients. Most of the guidelines highlight the social determinants of health, especially for chronic diseases like diabetes, is a social diagnosis. So the fact that we're not having a multidisciplinary care in the typical diabetes clinic was a big disadvantage for me. So all of those things were really bothering me. And that's why I say I was nursing my own frustration. Even with that kind of industrial amount of prescription, my patients' outcomes were very, very poor. A1C dropped by 0.5, another visit increased by 1, kind of yo-yo. Lifestyle medicine gave me a clean, acceptable opportunity to offer for my patients. I know we'll talk about it later. But my practice of endocrinology was very, very shaky before my encounter with lifestyle medicine.
I can't digest this words you were saying, so powerful, to be honest. As someone who has practiced as an endocrinologist for 20 plus years, and if this is how you feel, it's powerful. So thank you for sharing that and being very honest in expressing your frustration. Could you tell me about your experience of getting board certified in lifestyle medicine, and what was that journey like for you?
The journey is fun. That's a kind of underestimate, because you can imagine across those specialties, I had to take several board exams. I always dreaded board exams anyway, but this is the only board exam I voluntarily took. And, it's about mindset, right? It took me a couple of months to prepare. I enjoyed the journey, the preparation, and, it was excellent experience to me to pass through that. The other thing is, it is this journey which gave me the competency, the confidence, and the evidence base to help my patients and myself and my family, my friends, and all of that. Because before that, I was a typical expert in my field of expertise. And I was not very helpful for some very astute patients asking very good questions. And then this journey allowed me to grasp the basis behind the principles or pillars of lifestyle medicine to answer those questions confidently. And maybe some folks can practice lifestyle medicine without board certification, but to me, I was not there. My statements, my recommendations were very generic before that. This journey gave me a very concrete background to tell my patients with confidence that this is the way to go. And I cannot talk enough about the need for board certification, because that gives you a chance to immerse deeper, get the access for the publications put forward in the last half century for one or another reason, put behind the locked doors, and didn't have access for the membership in ACLM. The practice and the journey of board certification allowed me to have access and become a good clinician in lifetime medicine. Mm-hmm.
Now let's come to your clinical outcomes. I want to know how you have been integrating lifestyle medicine into your clinical practice, and especially because I believe you have some of the most impressive clinical outcomes on diabetes remission. So I really want to know, what strategies do you use to motivate your patients?
Correct. Okay, so the reason, let me take a step back. That's a very good question. And highlight why we're not practicing lifetime medicine. You can imagine there are probably hundreds of thousands of clinicians who know what to do, how to do it, but why we're not doing it, right? So first, it takes time. Unless you are very strategic, it's not time efficient. Second, try to address it earlier question that the knowledge gap is there. So if you are equipped with the knowledge and the competency in lifetime medicine, you have to be creative to find the time to deliver to patients, right? So the strategy I used was that, okay, I have this potent science, very effective science. I believe in it. How do I give it to my patients? So while working with my organization, Cone Health, trying to establish a lifetime medicine center, I could not wait. So I had to kind of deliver it to patients and see outcomes for myself. So I took a tactic from Maria Sharapova, a very good tennis player of our time. A few years ago, she was making a commercial for Canon camera, and she said, "Make every shot a power shot." So I kind of remember that and coined this term, like make every encounter a power encounter, meaning that, yes, you need to know the patient very well. So what I do is that the day before the visit, I go over my list and select a few patients conveniently scheduled, maybe at the end of the first shift or the end of the last shift, or sacrificing my own lunchtime, exercise time, family time. And depending on their disease burden, pharmacy burden, I decided to invest a little bit more extra time on them. To help me with that, I consulted the American College of Lifetime Medicine, complementary resources, and prepared a package which has all the brochures of lifetime medicine pillars, put together that. And then after a typical endocrinology encounter, I asked my patients, hey, if you are interested, I have a very powerful medicine which will address, 2, 3, 4 of your conditions same time. Will you be interested to listen about that? And if my patients say yes, then I sit down, spend those 10, 15 minutes with a pinch of passion. And so I offer it, So one other thing I want to mention here is the fact that I practiced medicine in Ethiopia, a small village where less than 10% of my patients used to read and write. In the US, we have 95% of our patients read and write. Such a huge resource that we're not using, or we have refused to use. So the brochures are written in English, plain English, maybe 6th grade level. So I go over those brochures in very strategic manner. And then I tell them to bring the package every visit to cover, things that we didn't cover on that visit. And then sure enough, I do have a number of hundreds of patients now. I was not even keeping data initially. I missed some, but after I saw a few patients coming back with incredible results, I started to document. So the first 45 patients, I analyzed the data with the help of a scholar from Case Western University, and showed that within 2 visits, 3 to 4 months apart, the A1C dropped from 10.5 to 3.1. 7.1, I'm sorry. So more than 3-point delta on A1C. Between those 2 visits, LDL dropped on average 61 points. On those 2 visits, between those 2 visits, weight loss was about 26 pounds. Again, without any additional prescription for medications. I think the paramount finding here is that when patients come to me for consult, the expectation for everybody is for me to give them more medications, especially insulin and the current GLP-1 receptor agonists for intensifying treatment. So these patients avoided all of that, felt better, lost weight, and data that I didn't even capture, like liver enzyme improvement, blood pressure, quality of life, all improved. And I kept on giving this package for now 500 plus patients, and then 200 plus returning with very similar findings. Some of my patients return and see my associates, so I don't have access for them, but this is telling me that 40 to 50% of patients respond and basically drive the outcomes we went to medical school for. And one thing I've learned through this journey is the fact that our patients are waiting and willing to work with us. The other excitement is that those 10, 15 minutes of investment are not only on the patient, but they take that home. They influence their families, their friends, their community members, their church members, their students, even some of them are teachers. So I can keep going on and on and on this one. But the question is, why haven't I practiced this way for the last 2 decades? And why are my colleagues not doing the same thing in the 21st century? Is it lack of knowledge, or is it lack of access, or what is? That keeps me awake every night. But this is an opportunity for me to highlight this. Hopefully, it will influence some people.
I want to just quickly ask you this question. With advancements in diabetes management, including new medications and technologies, where do you see the future of diabetes care heading, and how does lifestyle medicine fit into that vision?
It's very clear. The evidence is overwhelming at this point. We just know this works, especially type 2 diabetes with currently 37, 38 million and another 100 million with pre-diabetes. We just can't treat it with pharmaceuticals or surgery only. First of all, we cannot possibly prescribe medications for 150 million people. We have to deploy all tools we have on a spectrum, especially for patients who are motivated, willing to work with us, those who are relatively young and have a lot of life expectancy ahead of them, with people who are expected to contribute to the workforce. We cannot be burdening them with more medications when we have actually a very effective option available. So at least we have to offer it. I do see a great, bright future for lifestyle medicine. Well-informed individuals are already living it. If you look closely, frankly, even our policymakers, our big shot market movers are living lifestyle medicine. The question is, why are we not giving to the public at scale? So we can't be waiting for more evidence, more research. We do have enough research on millions of data points, patient encounters, but what we're not doing is implementing it at scale for patient care, for workforce, for schools, for even nursing care. The lifestyle medicine cuts across the board. Even at hospice care. So we need systems because this is beyond individuals at this point. Diabetes type 2 is a social diagnosis. So we cannot treat it with individual prescriptions. So we need to build systems to support the practice of lifestyle medicine at every opportunity.
I agree with you that lifestyle medicine has to become the foundation of all health and healthcare. Well, I really enjoyed our conversation. It's really been very inspiring to talk to you. But unfortunately, we're out of time. Thank you, Dr. Nida, for sharing your time and expertise today. Thank you to our audience for tuning in to this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.